Hi, my name is Terry Jordan, and my son is Cody Jordan, and he is a member of the CSNK2A1 family. I'd like to introduce Lulu Bogolin with Equine-Assisted Therapy. She has been the director of this organization for 3 years, and she's been with this organization for 12 as a volunteer. She is an amazing director, and she helps our kiddos just grow and grow and grow. Lulu, take it away.
Thank you, Terry. What a nice introduction. So yes, my name is Lulu Bogolin. I am with Equine-Assisted Therapy in Wildwood, Missouri. We have 2 locations here. I've been doing equine-assisted therapy since 2003. We started with 1 horse and a couple of riders, and we now service about 160 riders a week with 22 horses and 2 locations in the St. Louis County area, serving many surrounding areas as well. So equine assisted therapy can be both on the horse or off the horse. Many of our riders, the majority of our riders, actually participate in therapy that is done on the back of a horse. Each rider has 3 volunteers. So they have 1 person leading the horse, and then they have a trained sidewalker on each side of them. And the sidewalker's responsibility is to engage these participants in the activities that we are doing each day, and just allow them to have fun and yet be in a safe environment while they are receiving therapy on horseback. So some of the benefits of equine therapy can include physical, cognitive, and psychological. From a physical standpoint, we are going to notice that this strengthens weak or atrophied muscles or unused muscles. So it is very good in helping these riders just get better muscle tone all the way around. Just sitting on a horse engages every core abdomen muscle that we have. So core strength is a given with equine therapy. As that horse starts to move, you are going to now be working every one of those abdomen muscles. So again, the core strength that we get from equine therapy is probably one of the most beneficial things that we see in our riders, regardless of their diagnosis. Balance also comes from that core strength, and part of where we have seen research proven that helps this balance is equine therapy is a therapy that engages the entire vestibular system, and there aren't a lot of therapies that do that. And for many of our riders, the working together of the vestibular system is not always there. So this is a therapy where the entire, hearing, all of the senses are coming together, and they have to work together to just to be on the horse. So it's pretty amazing. It helps normalize our muscle tone. So whether we have overly tight muscles or weak muscles, you're going to see great benefits there. Flexibility is a wonderful physical attribute of equine therapy. Just getting on and off of the horse, and the exercises that we do while we're on the horse. Each session starts off with stretches. So we are stretching everything from our shoulders to our back, our core, our legs. So it's wonderful for flexibility in those who are tight or just needing to increase mobility. It assists in balance, which we talked about, and normalizing our balance patterns, if that makes sense. So the horse's gait is the closest gait to that of the human gait. And so for somebody who may not have that regular rhythm or that regular balance, it's wonderful for that. It moves our hips and our pelvis and our torso in what many would consider a normal walking gait. So again, it's helping the rider to feel what that quote unquote normal gait would be. It improves posture, which is really important for many of these riders. And while it's improving posture, because we must sit up straight to be in the proper position of a horse, we're then also increasing our blood and oxygen flow to all areas, but especially to the heart and to the brain. And this also increases our respiratory function, which really helps with speech. So for our clients that are delayed in speech, or maybe what we like to use word pre-verbal instead of nonverbal, because we have heard so many first words on the back of a horse, it really promotes the posture, the respiratory opening up, and allowing these children to speak, or speak more clearly. Just a couple other physical benefits. It increases neural input and how the brain reacts to all of that. It improves fine and gross motor skills. One of the things that we like to do at our barn is to not only be getting the physical impacts of having these participants on the horse, but then we have activities set up throughout the arena, and we will go back and forth from both fine and gross motor skills. So while they're balancing on the back of the horse, while they are engaging that core and they're sitting up straight, we may have them put puzzles together. We may have them hammer teas into a piece of foam. We're crossing the midline and we're putting rings on poles while we're on the horseback. So they are getting, you know, just a full dose of occupational therapy, physical therapy, socialization, all while having a wonderful time on the back of the horse and not even realizing that there's a therapy session in place here. And then the last thing that this does is it increases our endorphin and our serotonin levels. So for those clients that we see who are battling with any sort of depression or overwhelmingness, any of those feelings that kind of bring us down, it's been proven that horse therapy increases those serotonin levels, which brings us to a you know, just a self-confidence, a inspiring learning skills. We're learning a new skill. So it increases those levels as well. So those are just some of the physical impacts that we see. Some of the cognitive impacts that we see from our riders are that it improves body awareness and spatial relationships, which is really important for many of our riders who are either lacking in socialization skills or just those human relation skills. You know, how do we carry ourselves with our body language, and how does that compare to what the horse is telling us through the horse's body language, and how do we keep safe and proper distances, again, spatial relationships. Another thing is that it improves our eye and hand coordination. So when we're sitting on the horse, we're doing very visual activities, but we're also having to steer and rein that horse. So it's really teaching our coordination to work together. We talked about increasing gross and fine motor skills. Sensory integration skills. This is a huge one. We talked about that by working the entire vestibular system. So all of our senses are having to work together. Sometimes we'll even take these kiddos and turn them around backwards on the horse if we are noticing that they are having an over sensory input, or if they're just not engaging quite enough and we want more of a sensory input. So we have lots of training that our certified instructors are trained in to look at different activities that the riders are partaking in, and little things that we can do to, again, increase sensory or decrease oversensory. And then it really helps with decision making and getting these kiddos to think through situations. You know, okay, we want our horse to stop. What are the decisions that we have to make, and the sequencing progress that we have to do in order to get this horse to stop? So it's very good with decision making for most of our participants. And then natural consequences. Okay, why didn't our horse stop? What do we maybe need to look at to do a little different? So consequences, natural consequences, and thinking through our decision making is a huge impact of equine therapy. And then last, but certainly not least, we talk about the psychological impact of equine therapy. And I'm going to say that probably the biggest one there is self-esteem. These kiddos are coming in and they are riding a 1,200-pound horse, and they get each other. These horses and these kids understand each other. And I'll talk a little bit more about that in a minute. But the self-esteem and the confidence that they get from equine therapy is just amazing. It improves relationships, not only the relationship between the rider and the horse, but the socialization and the relationships that are happening in the entire arena, with the sidewalkers, with the horse leader, and with the other participants that are participating as well. Independence is huge. These kids get so much out of feeling independent in being able to, if they're able to, walk their own horse, groom their own horse, maybe help with tacking their horse. And then just the independence that they get from being able to, I don't like the word control, but handle their horse in a positive manner and having their horse listen to them is very, it just promotes so much independence. Again, this improves social awareness. Where is my horse? Where is my horse going? And where is that in conjunction with the other horses or the other people in the arena? Proper social skills. It really helps to enforce that. If we're exchanging toys or taking turns, that's a huge benefit for our riders. And then team playing. One of the things that we hear so often from our parents is that many of the kiddos that ride with us aren't on a baseball team or a soccer team. And so we try to encourage activities within the arena where they're engaging with each other in different games. We might do races at just a walk, but from one end of the arena to the next. And so they're getting to understand what it feels like to be on a team and what it feels like to win and to have to share or wait. So all of that comes into play. And I think the last thing that I'm going to hit at is just it provides empowerment. It makes these kids feel like they are doing something so good, both from the impact of the ride itself, taking care of their horse, helping the other riders. A lot of times we will get the riders to help each other while they're working on a specific task. If one rider is having a problem getting rings on poles, another rider might be able to say, well, what if you lean more this way? Or what if you stretch more this way? And so just a huge sense of empowerment and helping each other is an amazing benefit of equine therapy. So those are just a few of the many impacts that equine assisted therapy can have on our friends with OCNDS or really any other challenges as well. The one thing that I do want to talk about is the connection of the horse and the rider. I hear this all the time. Why horses? Why not dogs? Why not cats? We actually also have a therapy pig, but the one thing that I want to hit on with horses is horses are a prey animal and we humans are a predator. So when you think about the specifics of being a prey animal, one of them is they live in the moment. They don't have the ability to think about consequences, about what's going to happen 10 minutes from now, what's going to happen this evening. And many times they're not able to think about what happened yesterday or what is going to happen tomorrow. They live in the moment. And when you think about our friends who have either OCNDS or any other challenges that they live with on a daily basis, they're often living in prey mode or survival mode as well. They're thinking about this moment. How am I going to get through this right here, right now? Well, these two souls understand each other because they're both prey animals. They're both living in the moment. And so they understand and they get each other in a way that you and I may not ever be able to understand. But it works. They make a connection that is just unparalleled to any other forms of therapy that I have seen. This worked for my son. It changed his life. It changed our family's life. And that is one of the reasons that I became an instructor and am now the executive director, is because I've seen this full circle work. And so it's just an unparalleled connection. And I know to many parents, it can seem like a very frightening connection. You know, I'm going to take my child who already might be having challenges, whether they be physical, cognitive, or emotional, and pair them up with a 1,200 or a 1,500-pound animal. And yet what you're going to see is probably one of the most gentle forms of therapy that will take place that you've ever seen. And again, the kids are having fun. They're on the back of a horse. Most of them don't even realize this is a therapy session. So that just talks a little bit about equine therapy. We are in Missouri, as I said, but there are equine therapy centers all over the US and all over the world. A couple things that I would say to maybe look for if you are wanting to seek out equine therapy is you can Google equine therapy centers in your area, horse therapy. Couple of the things that you want to look at is who their instructors are certified with. So equine therapy is becoming more and more popular, and there are quite a few certifying entities that are popping up that are actually not insurable. So you want to make sure that you are dealing with a center that is able to provide liability insurance. And I'm going to name off 5 of the top therapy programs that our instructors are able to get certified through that we recognize at our center. The first one being Spirit Horse International. Spirit Horse International was founded by a gentleman named Charles Fletcher out of Corinth, Texas. And he actually started Spirit Horse International because he had a relative who was suffering from autism, and he was a lifelong horse person, and he wanted to see how he could help his cousin get through some obstacles with horses. So it transformed into a wonderful international organization, Spirit Horse International, who is definitely recognized by most of our major insurance carriers. And they have actually had children test out of autism through some of the research and proven methods that were created by Spirit Horse International and horse therapy. The other one is going to be PATH International. It's the Professional Association of Therapeutic Horsemanship. They too are one of the leaders in our industry in certifying, and they were actually founded as a group called NARA, and were renamed, I believe, back in the, well, I want to say it was probably at the beginning of 1995, 1996, they renamed into PATH. And so PATH International is another amazing organization to get certified through. For the mental side of things, we are looking at a program called EGALA, which is going to include a licensed mental health professional, and then also a horse therapist. And so they are also one that are leading the way in our industry. Equine Connections is another mental health program that we gain certifications through that is recognized in our industry. And then the newest one that is just coming into the therapeutic world is Certified Horsemanship of America. So it's called CHA. And they had just broken into the therapeutic side. They have actually been an incredible force in teaching able-bodied equine instructors, but they are now too breaking into the therapeutic world and becoming recognized by insurance companies. So those are some of the organizations that I, as a center director, would recommend that you looking into as far as when you're finding these equine therapy centers, what sort of certifications their instructors have. Those are the 5 that our center recognizes, and most of our instructors are duly certified in many of those. Some of them even have 3 of those certifications. I would just really also look at the background of their instructors. You know, many of our instructors also have special education degrees. Maybe they have worked as a para and been trained in that. We have a PT, an OT, and a licensed practicing counselor, and a speech pathologist on our core team. So aside from the incredible certifications that our instructors have, we also have a core team that we can go to if we're having specific issues that maybe we haven't seen before, or the typical types of therapy might not be working. So making sure that the centers are equipped and trained to work with your children would be very important. So that kind of sums up a little bit about what I can tell you about equine therapy. I don't know if you guys have any questions that you want to ask.
Lulu, you asked or said there's also horse therapy off the horse. Would you give us a little bit more detail about that?
Yes, yes. So non-riding therapy would include more of our mental type therapies. Those are going to be done on the ground. And we really want to make sure that our riders have good life skills and are building up their self-confidence. So if we have a situation where we just have a rider who is afraid to get on the horse or who has suffered some trauma, we may very well start with some groundwork exercises. And that would include learning your spatial boundaries around the horse, learning how to groom the horse, learning how to maybe tack the horse and taking care of the horse. Leading the horse is such an important thing that we love our riders to do, because anytime, no matter what size or age you are, that you can lead a 1,200-pound animal, you're gonna get confidence and self-esteem from that. So those are some of the activities that might take place off of the horse. We also do some team building exercises off the horse that we have done with all different abilities of our riders, where we might ask them to do specific tasks with their horse, such as getting their horse to step inside a hula hoop, or leading their horse through cones and making sure that the horse isn't walking over the cones instead of around the cones. So we'll do activities such as that off the horse as well. So yeah. So much can be gained both on and off the horse.
And I'm going to second the whole crossing the midline. I'm a very strong believer of this, but I can honestly say that it was when Cody was really small, and that whole shift left, shift right, and as simple as taking little clippies and putting them on with the right hand and then putting them on with the left hand onto the horse's mane. Yes. All that does so much stuff with their brain and their body that it is an incredible piece to help them move forward. Absolutely. I'm a definite advocate of the crossing the midline exercises.
I think we do crossing the midline almost every week in all of our activities, regardless of the client's diagnosis, because it is so powerful in working not only the vestibular system, but working the core, both sides of the brain working together. It's a wonderful activity regardless of abilities or diagnosis.
I'm going to go ahead and say, I know there's this video of Cody. I want to tell you that he has now been riding a full 18, going on 18 and a half, almost 19 years now. And it's a program that I feel very strongly about. One, the fact that we have been doing it for this long, and the benefits that he gets out of it are still happening today. It's not a just to do for a few years when he's younger, or a few years when he was a teenager, but the benefits are still building on each other as he gets more confident and his growth has taken place. So he's actually able to do more of the physical activities in putting away his own tack and hanging up his own things from the horse. So there is a confidence builder, and the fact that he already knows what he wants to do. And I know I've mentioned before, but his favorite thing is trotting, and he cannot wait to get out there and be able to say, walk on and trot.
Yeah, yeah. Yeah, so let's watch the video, and then if you have any other questions, and that would be great.
My name is Terry Jordan, and my son's name is Cody, and he's been doing horse therapy for 16 years. The first diagnosis was hypotonia. Failure to thrive was received at birth. At age 2, we received the diagnosis of speech apraxia. What is happening to him is a genetic thing, and we did not receive that until he was age 15. In the beginning, he really could not do anything. We had taken him to a special school, and the director said, I really think this horse therapy and equine therapy will help your son.
Equine-Assisted Therapy is a therapeutic riding center. We use horsemanship activities to enhance the lives of those with mental, physical, or emotional disabilities. I became a Spirit Horse certified instructor and was just so impressed that those of us who became certified in it started implementing little bits of it into the current program that we have.
Spirit Horse International is a nonprofit training and credentialing organization. We teach centers worldwide how to transform the lives of people with special needs.
Whenever we get to come out for therapy, Cody enjoys it so much, but I will say he loves trotting. And the faster he can say trot to make everybody run is the better for him.
When he first started riding, he wasn't able to even sit on the back of a horse. And to look at him now, pretty much riding again independently, he's turning into just your typical teenager, which is amazing. ManaPro's mission of nurturing life, I think, fits so perfectly in what we do here. They're nurturing the life of animals, which then in turn nurtures the life of people.
I think equine-assisted therapy has amazing therapy that takes speech, occupational therapy, physical therapy, and it can roll it all into one, and your child just does not know that they're doing therapy, but the confidence that comes out of being able to take this large horse and direct them around the arena, and the smile that's on their face is just incredible.
How many times a week or how many times a month would you suggest that a family look into coming to participate in equine therapy to really see kind of a beneficial result?
Yeah, that's a really good question. So most of our riders come once a week. We used to have 45-minute sessions once a week. Actually, post-COVID, we had to decrease our class sizes, which actually ended up being so beneficial for us. So we now have maybe 2 or 3 riders in a class, and they're riding for 30 minutes instead of the 45, depending on their abilities and their ages. So I would say once to twice a week for 30 minutes is a wonderful way to get started. We see benefits at just once a week for 30 minutes, but obviously if you're able to do more than that, or your center has a space for you to do that, it's certainly not going to hurt to do more than one time a week. 30 minutes we have found is just a great time, especially when these kids are starting out, for a couple of reasons. Depending on their age and their abilities, it might be that's how long we can keep their focus on what we're doing. A lot of times after 30 minutes, they're just done. And from the physical side of this, it is very physically engaging for these kids. They may be very sore after their first few rides, or if we at some point decide to add some ankle weights to help strengthen some of their muscles or elongate some of their muscles. So sometimes once a week is really perfect. But talk with your center, talk with your therapist, your certified instructors, and see what their comfort level is with the diagnosis we're looking at, and what their recommendations are. We then go into some more independent riders, such as Terry's son, Cody, who's now riding independently with us. So we still have a full support team there with him should it be needed, but he is basically riding his horse completely independently. And because of how long he has been riding, from the strength that he has gained from it and his abilities, he now rides for the full 40-45 minutes. So again, all of that needs to be taken into consideration when you're working with your center and with your certified therapists and instructors. Sometimes when a kiddo first starts out, we might be lucky if we get him on the horse for 5 minutes, and 5 minutes is better than nothing. You know, we have kids when they first start, they can't sit up. So imagine the comfort level of laying on a horse for just 5 minutes. It might not be the greatest, but you're still working on that core and you're still getting them on the horse. We literally have a rider that just started with us 4 weeks ago, who cannot walk, and he could not sit up on the horse the first week. We had the sidewalkers helping him sit on the horse. We had boppy pillows around him to help support him. 4 weeks later, he is sitting up on the horse. So that just gives you an example of what this can do. You're not always going to see benefits that, that quickly. The younger you start them, the better off this is. And so again, it really just depends on your abilities, the rider's abilities, and the center's abilities and recommendations on what's going to work for each individual.
And then, do you have a basic kind of definition of what the vestibular system is? You had mentioned how kind of impactful and beneficial it is to that system, but some people may not know that in the complicated term.
So the vestibular system is our sensory system all working together, and that is what gives us balance. So it's our hearing, our sight, our smell, our ability to communicate, all working together at one time. And for many of, especially our clients with ASD, autism, and especially if that diagnosis comes at a young age, at a very high level, this system has not always worked together. They are probably only using one of these systems at a time. Not that you or I, to the naked eye, could even tell that, but they very many times go into sensory overload the first time we put them on a horse, because it is the first time that all of those senses have started working together and that they have to feel that balance within their body. And they may scream at the top of their lungs for the first few minutes, for the first few weeks. It does go away. And as they start to experience that entire system working together, you're going to notice a huge increase in their balance. And you're going to notice a decrease in the oversensory loads that you sometimes see, and especially when they're on the horse. They're going to start to calm down and understand, okay, yes, this feels very overstimulating to me right now. It's not something that I'm used to, but it's something that you and I are used to. So as they start to experience this system, this whole vestibular system, all the senses working together, and they start to feel that balance, it becomes exactly what you and I are feeling every day. So hopefully that helps explain it a little bit better. But it's basically all of our senses working together that, for the most part, most of us take for granted each and every day. But many of our riders don't know what that feels like. And that is many times what causes their sensory overload.
Well, I can't thank you enough for this truly incredibly informative talk about equine therapy. It's something that comes up a lot in our group from individuals who have experienced it, including our family as well, have had amazing experience utilizing and engaging with equine therapy. And I know that other parents, that when they hear this, they're really interested in, well, what is this? And how do I go about even seeking out equine therapy? And I think that you laid out a really great plan for everyone. So you gave them some great basic knowledge, even more than basic actually, and what to look for in an equine therapy center, the benefits of equine therapy. We can't thank you enough for your time and for being here with us today. Thank you so much.
Thank you. Thank you for having me.